We're all in unusual circumstances right now, and for some, the uncertainty of the coronavirus pandemic can be too much.
Especially those battling addiction. NBC2's Joseph Ojo shows you how, even in isolation, there's always someone you can turn to.
By now, we have all heard the message. Practice social distancing, no group gatherings, but what about those who rely on group meetings to work through recovery from alcohol or drug addiction? Now, there is help in the palm of their hands. The rise in coronavirus cases,
being anxious and terrified by a virus that we can't see,
continues to affect our everyday lives.
We all understand there's financial and economic implications for this. People are losing jobs or being laid off or having reduced work hours.
CDC guidelines say we should self-isolate at home to prevent the spread of COVID-19, but for some Alcoholics Anonymous members,
sometimes the home situation isn't the best place to be stranded.
When home isn't the answer,
a big difference between spending a week at home versus spending 3 months at home.
People who are recovering tend to isolate or they turn to their sponsors.
Financial insecurity for people like us is another driving factor to either get closer to this program of recovery or get closer to the bottle.
But what if social distancing practices have put face-to-face AA meetings on hold?
A lot of the churches have closed their meeting spaces.
We're getting a little stir crazy being locked up at home. Maybe we're not sleeping as well because we're not as physically active, we're not moving around.
An addiction therapist says you shouldn't worry if you feel like you're about to fall into old habits. Meetings in our area are being held via Skype and Zoom, and if you can't connect virtually,
to not isolate and to stay in connection. The telephones still work. Use your telephone.
Joseph Ojo, NBC2.